A World in Balance. The story of health awareness. Once upon a time, in a not-so-distant world called Aurelia, health was taken for granted. The people of Aurelia were known for their advancements in technology, infrastructure, and wealth. But beneath the surface of glittering skyscrapers and humming factories, a quiet crisis was brewing. People were getting sick, not just from one disease or virus, but from lifestyles that had drifted far from nature, and minds burdened with stress and neglect. The once vibrant villages where children used to run freely were now silent, and cities echoed with ambulance sirens more than birdsong. In a small village called Verosa, lived a young girl named Lena, just 16 years old, but wise beyond her years. Her mother had died from a preventable heart condition, and her father, a farmer, had recently been diagnosed with diabetes. Lena was heartbroken but not helpless. She had a dream: to awaken the world about the importance of health awareness. Each morning, Lena would read articles, medical books, and research journals. She started a small community group called Healthy Hearts of Verosa. First, only a few children showed up. But Lena's enthusiasm was contagious. She taught the basics: wash your hands before meals, eat more greens and drink clean water, take a walk every morning, avoid too much sugar, salt, and stress. The message was simple but powerful. Meanwhile, the World Health Organization (WHO) had launched a new global initiative called One World, One Health. Their goal: to spread awareness that health is not just about hospitals and medicines, but about prevention, education, and lifestyle. Lena's efforts caught their attention. A regional health officer named Dr. Matteo visited Verosa one sunny morning. He was astonished to find school children discussing BMI, body mass index, nutrition labels, and the effects of tobacco. He sat in on one of Lena's sessions, where she was explaining how mental health was as important as physical health. Stress, she said confidently, is a silent killer, and talking about your feelings is not weakness. It's healing. Dr. Matteo invited Lena to speak at the Global Youth Health Summit in Geneva. It was her first flight, her first trip abroad, and her first time addressing such a large crowd. Nervous but determined, she shared her story of losing her mother, caring for her father, and turning her grief into action. Health awareness, she said into the microphone, is not a luxury. It is a right and a responsibility. Her words touched the hearts of thousands. Her speech was translated into 20 languages, and within a week, the hashtag #BeHealthAware trended worldwide. The ripple effect. Inspired by Lena, teenagers in Tokyo started morning fitness groups in parks. In Nairobi, mothers formed healthy kitchen clubs. In New York, students campaigned for mental health counselors in schools. And in Bangladesh, where Lena's story became part of the school curriculum, children planted trees to fight air pollution, understanding that a healthy planet equals healthy people. Governments took notice too. Several countries increased health budgets, banned harmful processed foods in school cafeterias, and made yoga and meditation part of daily education. Doctors, once overburdened with sick patients, now partnered with teachers and social workers to promote wellness. Hospitals invested in preventive care programs, and slowly statistics began to shift. The global rate of preventable diseases dropped by 12%. Obesity in children began to decline. Mental health awareness programs increased employment and reduced suicide rates. People were not just surviving, they were thriving. A new holiday. 5 years later, the United Nations declared April 7th as World Health Awareness Day, inspired by Lena's original village campaign. The world paused on that day, not just for speeches and ceremonies, but to reflect, learn, and act. Every city rang its bells at noon. People meditated for peace. Children danced for fitness. Streets turned into walkways. Junk food outlets turned off their signs for one day. It was a new world, a healthier world. Epilogue. Lena, now a public health researcher and motivational speaker, returned to Verosa every year on April 7th. She'd sit under the mango tree where she once taught a handful of kids and smile at how far a small idea had come. One child asked her, "Didi, how did you change the world?" Lena knelt beside him and whispered, "I didn't. We did. Together. One step, one habit, one voice at a time."